Welcome to This Explainer. Today we're going to unpack the rigorous science behind something that, well, you probably have it sitting right in your pantry right now. Ginger. But to be clear, we're not just looking at folklore or old wives' tales here. We are diving straight into the hard, evidence-based pharmacological data to see exactly how ginger acts as an adjunct cancer therapy.
Now, it sounds almost too simple to be true, doesn't it? Like, can a common kitchen spice actually fight cancer at the cellular level? Usually when we think of cancer treatments, we picture massive pharmaceutical interventions, right? Not the produce aisle. But, as we'll see, the biochemical reality of this root is incredibly complex, deeply powerful, and honestly, it's absolutely fascinating.
So here's our roadmap for today. We'll start by looking at the bioactive power of ginger, then we'll jump inside the cellular battleground. After that, we'll talk about easing the chemotherapy burden, look at the evidence in specific cancers, and finally, wrap up with the limitations and where this is heading in the future.
All right, let's dive right into part one, the bioactive power of ginger.
So what actually makes ginger so medically fascinating at a biochemical level? Well, we aren't just talking about a strong flavor profile for your stir-fry. We are dealing with dense, peer-reviewed pharmacological profiling. Modern oncology is actively investigating how specific compounds inside ginger extracts affect cancer pathophysiology. Researchers have actually isolated potent chemical compounds right there inside the root that have measurable, repeatable effects on human biology.
And here are the heavy hitters you need to know. 6-gingerol, 6-shogal, and paridols. These are the primary biochemical agents really driving these anti-cancer effects. First up, 6-gingerol. This is the most abundant compound in fresh ginger, and it functions as a massive anti-inflammatory agent throughout the entire body. Then we have 6-shogal. Now this is actually a dehydration product of gingerols, meaning it forms when the ginger is dried or processed, and it shows vastly superior bioactivity. Crucially, 6-shogal is what we call pro-apoptotic. In simple terms, apoptosis is programmed cell death. So a pro-apoptotic compound literally flips a suicide switch inside cancer cells, telling them to self-destruct. Pretty amazing, right? Finally, we've got paridols, which act as a defense mechanism to help regulate and manage severe oxidative stress within the cells.
Moving on to part two, inside the cellular battleground.
Let's zoom in and see how this builds into an actual microscopic attack. We hear the term free radicals tossed around a lot, but think of them like cellular rust, causing violent, chaotic damage to your DNA. And that damage is exactly what can trigger cancer. Well, these ginger bioactives work together in a highly coordinated defense system to neutralize that rust. 6-gingerol targets something called the NRF2 pathway. You can think of NRF2 as a master switch inside your cells. When it's flipped by the gingerol, it boosts the cell's production of its own protective armor. Meanwhile, 6-shogal acts kind of like a sponge, just directly scavenging and soaking up those free radicals before they can cause any damage. And then paridols come in to protect the outer walls of the cell by inhibiting lipid peroxidation, which effectively stops the cell walls from degrading. Because of these strong anti-inflammatory mechanisms, ginger bioactives can actually act to cut off a tumor's communication lines. You see, tumors are incredibly hungry. To grow and spread, they literally need their own dedicated blood supply. So what do? They send out chemical distress signals called VEGF to trick the human body into building brand new blood highways directly to the tumor. This whole process of building new blood vessels is called angiogenesis. Basically, if a tumor cannot build those new blood vessels to feed itself, it simply cannot grow. Gingerol and shogal step in and directly disrupt those VEGF signaling pathways. They scramble the tumor's communication lines, suppressing its ability to recruit that vital blood supply, essentially starving it of the resources it needs to replicate.
Okay, let's head into part three, easing the chemotherapy burden.
Let's zoom out from the cellular level to the whole body for a second and look at how ginger supports patients going through the grueling reality of conventional therapies. Treating the tumor is obviously crucial, but supporting the patient is just as vital. A massive nationwide study involving 644 patients demonstrated that ginger significantly reduced chemotherapy-induced nausea when taken alongside standard anti-nausea drugs. Now, conventional drugs are fantastic at stopping active vomiting, but patients are very often left suffering from this lingering, debilitating nausea. Why does that matter so much? Because severe nausea often leads to dangerous weight loss, malnutrition, or patients just wanting to give up on their life-saving chemotherapy entirely. This data proves ginger is an incredibly effective, evidence-based tool to fill that specific gap in patient care, vastly improving their quality of life so they can actually endure their treatments.
So what does this mean practically? Well, studies suggest an effective dosage is somewhere between 1 to 4 grams daily. But there's a massive difference between culinary use and medicinal use here. Heat destroys those delicate 6-gingerol compounds, so if you're seeking the medicinal anti-inflammatory benefits, you really must avoid cooking it. Taking it raw, freshly juiced, or in standardized clinical capsules is necessary to preserve the active compounds. Furthermore, safety is absolutely paramount here. Memorial Sloan Kettering actually issues a critical surgical warning about this. Ginger naturally thins the blood. Because of this anti-clotting property, patients must strictly suspend their use at least 2 weeks before going into an operating room to prevent any dangerous bleeding complications. Definitely something to keep in mind.
Next up, Part 4, Evidence in Specific Cancers.
Beyond just symptom relief, there is a massive amount of clinical focus right now on colorectal cancer prevention and therapy. Because ginger acts as such a potent anti-inflammatory throughout the digestive tract, trials show daily supplementation actually alters the environment of the colon, making it incredibly hostile for cancer progression. Specifically, the supplementation reduced proliferation indices in patients. That's a fancy way of saying the ginger compounds were actively slowing down how fast the precancerous or cancerous cells could divide and multiply in the gut.
The source material also thoroughly documents ginger's ability to inhibit tumor growth across several other specific cancers. For instance, in breast cancer, it suppresses proliferation by targeting the PI3K/AKT pathways. Think of these pathways like the cellular engine that drives rapid growth, while ginger compounds effectively shut that engine right down. In prostate cancer, it literally stops the cell cycle in its tracks, a process known as G1 phase arrest. Imagine the cancer cell as a car trying to drive forward to replicate. G1 phase arrest is like ripping the emergency brake so the cell physically cannot move forward to divide, all while lowering PSA levels. And in ovarian cancer, as we discussed earlier with that suicide switch, it effectively triggers apoptosis, forcing the tumor cells to destroy themselves.
Finally, let's look at Part 5, Limitations and Future Directions.
Look, we have to confront the clinical reality here. If this root is so incredibly powerful, why isn't it a standalone cure, right? Like, why don't we just treat cancer with really strong ginger tea? To truly understand its potential, we have to look at its biological limitations. It really comes down to a stark contrast between a petri dish and the human body. In a lab environment, which we call in vitro, ginger extracts display incredibly high cytotoxicity. They easily destroy cancer cells. But in the human body, in vivo, we hit a massive roadblock: poor systemic bioavailability. You see, our digestive systems and our livers are incredibly efficient chemical filters. They metabolize these compounds so incredibly fast that very little of the active 6-gingerol or 6-shogal actually makes it into the bloodstream, let alone to the tumor site in a high enough concentration to be lethal to the cancer.
So how is modern medicine building solutions for this? Well, researchers are actively developing cutting-edge methods to bypass that liver filtration system. The most promising step right now is engineering microscopic nanoparticle delivery systems. By wrapping the ginger extracts inside lipids, they're essentially creating molecular Trojan horses. These nanoparticles protect the delicate bioactives from being metabolized in the gut or liver, safely transporting ginger's power directly into the cancer cells. Scientists are also designing synthetic analogs, basically tweaking the chemical structure of gingerol so the body absorbs it better and aggressively testing synergistic combinations. This means pairing these ginger nanoparticles with standard chemotherapy to violently boost the effectiveness of conventional drugs while minimizing the side effects. Which leaves us with a really fascinating question to ponder. As our delivery technologies evolve and we perfect these molecular Trojan horses, could this humble root sitting in your kitchen right now become a true cornerstone of future precision oncology? The underlying molecular machinery is undeniable, and we are right on the cusp of unlocking exactly how to deliver it effectively inside the human body. Thank you so much for joining me for this explainer. Keep questioning and keep exploring the amazing science all around us.